Welcome to Mind Over Matter. Today it's a pleasure to welcome Valerie Dalton, who is the Community Education Coordinator for NorCap Lodge, which is part of Caritas Norwood Hospital. And today we're going to talk about meeting the needs of addicts. And so let's start with addicts. Who are they? And maybe you could catalog some of the needs, and then we'll move on to some of the other problem areas around meeting the needs of addicts. Welcome.
Thank you. Addicts can be anyone in this day and age. It can be a person like you and I who has a back injury and goes to the doctor and gets prescribed pain medication and takes it accordingly. And even if they're not predisposed genetically to be an addict, they can become an addict because of the chemical products of the drug. Mm-hmm. So any one of us can become an addict. Just because of pain management. Young kids, they used to start smoking pot. Oxycontins are more available now, so instead of just starting at smoking pot nowadays, they can go right into Oxycontin, and they can become addicted at a very early age. With alcohol, it's so easily accessible. Anybody can become an alcoholic, pretty much. So it's all of us. It can affect all of us, and it's in everybody's family.
Okay. And obviously, all these people recognize that they have a problem once they do?
No, doctor. Some people can live their whole lives without ever getting treatment or realizing that they're addicts or they're dependent on a substance. They can drink and drug to the end of their lives, and they'll never own up that they are an addict or an alcoholic.
Why do you think? What do you? I mean, I suppose it's in the nature of the illness. They're addicts. They're addicted. But why is it that you think they don't come to a point when their lives have been so topsy-turvy, secondary to their addiction, that they realize that they've got to do something to stop it? What keeps them, do you think?
Most people do realize that when their lives become so out of control that something will happen and they will seek treatment. It could be like a family intervention. Their family or friends will get together and, encourage them to go into a detox. But a lot of times people, if their lives, like the executive that will have like a few martinis at lunch, then he comes home and drinks. I mean, he can still get up in the morning. Eventually it does catch up with them, but it can take years. It can take years for that to happen. Mm-hmm. And in the long run, a lot of damage can be done until they seek treatment. There's going to be a lot of damage with their health, mentally, physically, spiritually.
So do all people have to get so bad before they can, you got to get to the bottom of the barrel before you can climb up?
In my experience, it seems that way. I've worked in detox or methadone clinics for over 20 years, and I've seen most people hit the bottom of the barrel before they come in and get treatment. Not all the time, but a lot of times I see, whether it's a job loss or a loss of a spouse or a boyfriend and girlfriend going through a divorce, all these things, it might take a lot of losses for them to come and get treatment. Mm-hmm. Or if it's a younger kid, I mean, a lot of kids, their parents will say, they'll kick them out of the house. So you have these 18-year-olds that are homeless, living on the streets, living in the woods. Around this community, I know kids that have lived in the woods all summer because their parents won't take them in when they're drinking and drugging. And as a parent, I think that's a really difficult thing to do to your child, but it's necessary. It's almost necessary, if they want them to get help. And a lot of kids they get tired of not being able to take showers, and that's when they'll come into treatment. When they're living like that in such an early age, that's when they'll seek treatment, when they have no place else to go, when their family doesn't want them anymore.
So there is a kind of inability, or what is it that keeps people from knowing that their car is headed toward a tree, that they're really headed toward major trouble?
Well, some people, I believe, I've heard people talk about spiritual awakenings. I used to work with this nurse at another detox, and she often told me a story about she was down in the basement, she had a cigarette hanging out of her mouth, she had a beer between her legs, she had a tie around ready to shoot dope, and all of a sudden, it's like, you know, a spiritual awakening. She just said to herself, and she had been doing it for years, and she had just said, what am I doing? It's what she called a spiritual awakening, and something within her just said, she said that she couldn't live like this anymore. She just couldn't go on. Whether you want to call it a higher power, a God, or whatever, but something reached her, and she could no longer live that way anymore. She got sober, and she ended up going to nursing school and becoming a detox nurse. And you know, I think sometimes that happens with people, is they do have a spiritual awakening.
In her instance, do you know how much she had lost before she arrived at that moment?
She was really down and out. As a matter of fact, she has since passed away, and I often wonder, she had a brain aneurysm, and I often wonder if it was all those years of drinking and drugging. Most likely it was. So she passed away at a very early age, 42 years old. And even after being sober for 10 years, that damage was already done. You know, anytime you pick up a drink or a drug, you don't know what's going to happen. You get behind wheels of a car, or, you know, anytime you put a needle in your arm, you don't know whether you're going to live or die. Lately, you know, there's just been a lot of ODs with the younger kids, 25-year-olds, all over, everywhere, are dropping dead from opiate abuse. It's happening so much nowadays.
And the message isn't getting through?
I really don't think so. I don't think the message is there. I always feel like almost the media glorifies drinking and drugging. When I was growing up, it was like, you know, nice girls, you didn't shoot dope. I mean, it had a stereotype of, it was in the inner city, it was poor people, it was like jazz musicians, or you know, it was just a stereotype of, you know, these horrible people doing dope. You know, you just didn't do it. You just, you know, that's what, you know, you just wouldn't do that. You wouldn't do that to your parents. You just wouldn't do it to your family or whatever. I mean, I thought it was a very strong message, at least in my family, that you didn't do that. And I lived through the 60s and 70s and Vietnam and all that. And, but you just didn't touch heroin. You know, there's plenty of other drugs out there that we've touched, but not heroin. And nowadays with OxyContin, you don't have to put a needle in your arm to get high on an opiate. You know, you could just take a pill and you're just as high as if you're doing a bag of dope, if not higher. So that stigma, what I would like to see in the media is really have it portrayed, have the stigma attached to doing drugs, especially dope, because it's so dangerous. It's so dangerous. And it's a major ill of society, I think.
Are doctors part of the problem?
Most definitely, most definitely. And I would hate to be a doctor, because how do you know? I've had a lot of patients at NORCAP that have serious back injuries. They have ruptured discs, a couple of ruptured discs. They're walking around, they're limping.
You're looking at one.
Right,
Yeah.
okay. And they go to their doctors, they're prescribed Percodans, and then they have to take more, and then they're more. Finally, they're addicted, and then the doctors get frightened, and they're cut off. And then what do? What they do is they turn to heroin. People that they would never think that they would do heroin will turn to heroin. It's cheaper. Once that prescription runs out, it's cheaper to get. And it's cheaper to buy a bag of heroin than it is to buy a bag of pot nowadays.
Of course, the other piece of that problem, as a physician, I can tell you, it's much easier to say yes than to say no.
Right.
I mean,
and then you get scared, though. Then you get scared when the patient keeps coming to you, and you recognize that the patient's addicted, then what do? Then you're in a tough position. You don't want to get in trouble with the FDA or DEA. And then, but you know the patient's strung out, then what do? Well, you tell them to go to a pain management clinic, a pain clinic, you know, where they teach them biofeedback. But that pain is very real to the patient. And that's when my heart really goes out to those kind of patients, because it could be me, it could be anybody, you know what I mean? What do you say? I mean, is methadone the way to go? You know? Is methadone the way to go? Who knows? I mean, I don't know. I mean,
Because I've discussed methadone on this program, and Betty Braden was the presenter, and she talked about the pain of withdrawal, so that in a sense it becomes a problem superimposed upon a problem, because even when there's a willingness to get off the heroin, there's such dread of the pain that accompanies the withdrawal that the problem then just keeps promoting itself.
exactly.
Yeah.
When you withdraw from, I actually worked with Betty, and when you withdraw, methadone is the worst detox, they say. It is very, very painful. When you withdraw from heroin and opiates, you have hot and cold symptoms, your skin crawls, you have nausea, vomiting, diarrhea, you have extreme achiness, you have leg cramps, you have diarrhea, you have every symptom, the worst flu that you can imagine. The worst flu. And often as a detox nurse, I would say, why don't they just, you know, bite the bullet. Within 3 days, it will be over with. You know, they'll be all better. It will be out of their system, and the monkey will be off their back, and they'll be all better. But I'm not the one that's going through that torture. It is very, very painful to go through heroin withdrawal. Now, this is what I want the media to recognize, to let people know that, okay, you get high, it's the best feeling in the world, but teach people about the pain of withdrawal.
The price they'll pay.
The price that they'll pay. Now, I saw an ad on, and you know what? It wasn't even shown that frequently. There was a TV ad on that showed a beautiful woman. She was like dressed up beautifully. Her hair was great. She had a gown. Her face was gorgeous. And through the computer, they did an ad about addiction. And they made her, by the end of the, you know what I'm talking about, by the end of the commercial, she didn't, you know, she got more drawn, she was horrible, she was straggly, and the last shot was of her not having teeth. Well, guess what? That's very real. That's what happens. And, you know, do we see that commercial that much anymore? What happened to that commercial? Why isn't that like being,
We'll have to take a break.
Okay.
I think we'll pick up with families, but after the break.
Okay.
Thank you.
Okay.
To care is to help the people when they're in the time of need, because they also have dreams just like we do.
We feel bad and we need help sometimes.
If no one would be there to take care of me, I would just feel like crying. I wouldn't be happy if I couldn't eat for a few days.
I couldn't feed myself and I couldn't take care of myself.
I know that I can always turn to somebody when I have any troubles and they will help me. But there are other people who have much harder problems. They wouldn't have anywhere to live. They wouldn't have food.
How can you sleep under a roof and in a cozy bed when some people are out there with nothing?
It's like to them having a big brother or a big sister looking out for them.
Care for other people so they can care for you.
Care. How many lives can you change today?
While progress should never come to a halt, there are many places it should never come to at all. So we work locally with communities, businesses, and people like you to save precious places around the world forever. I'm Paul Newman. Help the Nature Conservancy save the last great places.
I'd like to move on and talk about families and where families are in problem solving. But perhaps we could just pick up on your comment about the media, because obviously families need to be educated to some of the difficulties.
Well, I think the pain of withdrawal should be portrayed in the media more often. I mean, I really feel like people should know the truth about what it's all about, what it's like to detox from opiates and alcohol. In alcohol, I haven't even touched on alcohol, the shakes, the seizures, really they can die from alcohol detox. And that's what needs to be shown, portrayed in the media. And I don't see it.
So the message, you say, isn't getting through.
But I don't think so at all.
Now, a big part of the solution and a big part of the problem sometimes is the family. Where are families today? I mean, I'm sure we both have many anecdotes where the families are desperately trying to get somebody into a detox, and then as soon as they get them into the detox, they get snookered by the family member into getting them out of the detox.
Right.
And let's talk about families for a moment.
They can be the biggest enablers of the patients.
What do you mean by that? That's a important concept.
They can just go along and they think they're doing the right thing, but they're enabling their substance abuse. They're almost encouraging it. They're allowing it. Maybe because of their own substance abuse, right, or their own denial that the family member has a substance abuse problem. Everybody's so busy nowadays. I mean, if they ever sit back and see what's really going on, especially with your children, you have to recognize when that kids are using drugs. It can be easy to mask in the very beginning, but you have to be aware of what your kids are doing, who they're hanging out with, any kind of mood changes. It's a gradual process with drug abuse, you know what I mean? It can take time in the beginning to get really strung out, but you have to be aware that they're getting into trouble and talk and try to help them. But then if they're old enough, if they don't, you have to set rules and limitations also.
Well, talk about that, because how do you get families beyond the wringing of the hands stage, where they feel so helpless in doing anything?
Well, I think parents have to be stricter nowadays. I think if they don't follow their rules, you have to do certain things, like I mentioned before. You have to, if the kids are at a reasonable age, you got to throw the kids out. It sounds rough, but, you don't allow it in the home. You don't allow it in the home. And you try to seek help. If they don't want help or whatever, there are ways going through the court system to make the kids get treatment. You got to use the courts. Or there's other ways of making the kids get treatment.
But we both know that's a big step for families to take.
It is.
They're reluctant to go to court and go public, which is part of implicit in going to court. Many of them are obviously very reluctant to sort of throw the family member out, tough love it. Why do you think that's so?
Well, I mean, it could be the parents have their own substance abuse problems, that they're in denial. Oh, well, the kid smokes pot or does a couple bags of dope, but they're drinking wine every night. You know what I mean? So they're not clear either. You know what I mean? It could be that the family, that they're all substance abusers. That could be an issue, or it could be that people are so busy nowadays, they work so hard, and they're just not aware of it as much. They don't take time out and really look at the kids or whatever. But, it's a tough situation. It's in my family, and, it's in everybody's family. I don't have any answers about that, but I know at NORCAP we do involve the family. We have family meetings for the patients. Once they leave NORCAP, they have a family meeting before they leave, so a plan can be in place for a treatment, or if they relapse, what can the family do? We have counselors that are experienced that do work with the family, so, but it is tough. One thing the family can do is go to Al-Anon and really learn about the disease, really learn really learn about the disease and how it's going to affect their family. I mean, they have to get educated. The important thing is to educate themselves about the disease of addiction, and then they can go from there. They have to know how not to be suckered into the disease. They can get sucked right in also, and it's very difficult for parents.
Do you think guilt plays a part?
Guilt? Oh, of course, yes. Yeah, it's like, what did I do? Of course it does. What did I do to make this kid act this way, be this way? Yeah, yeah. But a lot of parents are so permissive nowadays. They allow so much in their homes. I really think there are a lot of permissive, they just let kids do what they want, because it is so hard to say no. It is so hard to set rules and limitations and to adhere to them,
Of course, I think as a parent, I think my kids are exposed to so much more. My ability to control them seems far less than my parents' ability to control me. And what I'm exposed to.
Right.
They're getting pressures in school, they're getting lots of stimuli from the media, it's everywhere.
Right. I live in the inner city, and I have a 12-year-old son, and I'm constantly on my stoop, watching everything, listening to everything, really being aware of what's going on. And I feel like I'm not only a parent to him, but to the other kids in the neighborhood. I'm constantly saying, don't swear, and don't say that, and don't do that. But you have to be aware of what the kid is doing, what's going on.
God forbid, but let's say it's 20 years from now, and he's really actively drinking. What do you think it would take you, and what would be your thought process? Maybe that's the important emphasis, that might lead you to kicking him out of your home?
Well, I think in 20 years he should be out of
Well,
he should be out of the home.
15 years.
I would just hopefully.
When is tough love the proper
yeah,
intervention?
When the kid's out of control, when they are just not doing anything in their life, when it's affecting their health, their mental, physical health, when they don't have any purpose in life, when they're not doing anything in their life, when it's really taking over. You can tell that. At least I know I could tell when drugs or alcohol are really affecting them physically and mentally. I could tell that. I should hope so. You know what I mean? You tell by their appearance, by the way they're acting, by the way they're speaking. This is what you have to really be observant of. Any kind of different clothing or friends.
So you've said to your family member, you cannot drink here
in my house,
and they do.
Well, that's when you have to throw them out. If they, I don't know about drinking. If they have a bottle of wine in the house, right. But if they, what can you do about that? That's more accepted. But if it's when they wake up in the morning and start drinking all day and all night, that's when you cannot allow that. You have to throw them out. You have to say either get treatment or you're out. You can't allow that to be in your house. You have to be strong.
I'll get treatment. Now, you and I don't agree on what the treatment should be, though. Or I get treatment because I go to an AA meeting every other week or something like that. I get half-assed treatment. What?
You do have to do, I think you have to do ultimatums. You have to, if AA works, NA works, but you have to go every day. In the beginning, you have to go every day. They have to have a treatment plan in place. At NORCAP, before these people leave NORCAP, they have to have a treatment plan in place, whether it's a halfway house or sober housing or a 14-day program. They have a list of meetings every single day of the week, day and evening, where they can go for help. They can't leave without that treatment plan in place. So you have to you need help. You have to go get professional help, whether it's outpatient counseling, going to an outpatient clinic. You have to reach out and ask people for help you can't do it. You might not be able to do it by yourself to get your kid treatment. You know what I mean? But you have to reach out to people that can help you help your son or daughter get treatment. You know what I mean? There's so many places that you can go yourself for help. You know, if you, by that time, my kid would, you're talking about, you know, an older adult or whatever, if you said 15 years for my son, by then he's on his own and he'd have to do it himself, you know what I mean? But if you have a teenager at home, you have to, you know, and they're just being belligerent and won't get help, there's certain things, there's places that you can go, and if you have to go to the courts, that's what you have to do.
So you're basically saying that the consequences are so dire that really active interventions by families are really necessary, and maybe families have to figure out a way to awaken to that, that it's hard to do but cruel not to do?
Yes, tough love, I totally agree. Heroin is so dangerous. OxyContin is so dangerous. I've seen too many young people die OD from these drugs. You know, if my kid was doing it, believe me, I would do everything in my power to get that kid into treatment. I would do anything and everything, even I hate to say it, but go through the courts and put it in. I don't think jails are the right way, but nowadays with drug courts, you know, I would be more open to drop a dime on the kid, you know what I mean? Because it doesn't mean if you drop a dime that they're going to be incarcerated, but now that they have drug courts, you know what I mean, where they're closely monitored by a counselor, by judges, they get positive reinforcement, they get stars if they do the right thing, they have to get their GEDs, they have to get life skills, they have to do things. If not, they go to jail. Nowadays, it's, you know, there's an alternative to jail. So if you have to go through the courts to do it, I would say that's what you have to do. It sounds very, especially for me, you know, the last thing I would do is want to get police involvement or anything, but if that's what you have to do, that's what you have to do. It sounds horrible, but...
Okay, well, you know, I think we'll sort of take a break, and then maybe we could talk a little bit about help seeking and help rejecting with families and with individuals, but first we'll take a break.
Okay.
Thank you.
My Youth for Understanding experience was the best thing I've ever done in my entire life.
If you want to learn a language, this is how you do it.
You have to live here and you have to breathe in the country.
You meet a whole new family that are willing to accept you and take you in.
I feel like just like I'm a part of the family. Being involved with the family, living right at home, that has been my best learning experience so far.
You only live once, so you do it, try it, live it. It was great. It was incredible.
Go global.
In RSVP, we don't just want to change the world. We're old enough to know how.
Retired and Senior Volunteer Program is a program for people 55 and over to work in many different capacities in the community.
I worked with sixth graders, and the teacher told me that her sixth graders' scores were much higher than any of the other scores. I was delighted.
Show us a problem, a tough one. We have the skills to find real answers.
They're basically eyes and ears for the deputies.
We have a staff of 300 volunteers restoring aircraft for the museum.
When you built the plane, where did you get the parts?
We made them.
Your life experience, shared for a day, a week, a year, that's what it takes to make the world a better place. It takes you.
So, all right, let's talk about NORCAP for a moment as a very excellent prototype of services that are out there. What's the range of services? Who uses those services? And then maybe in the last segment we can talk a little bit about some of the difficulties people have getting to services and maybe some of the difficulties services have treating some of the people.
Okay, NORCAP is a 43-bed unit in Foxborough. It's a beautiful bucolic setting, rural setting in Foxborough, which is good for inner city addicts to come out and get off the street, away from it all. I like it because of that.
So it doesn't matter where you live.
It doesn't matter where you live. You can come from as far away as Springfield, Lawrence, Lynn, Lowell, all the L words. Any place, anybody in Massachusetts, and we've had people from Rhode Island come to NORCAP. We take insurance. We take insurances. Most insurances we take: Medicare, Medicaid, the Boston Medical Center Net Plan. We take all those insurances. We do have free beds available on a case-by-case basis. You have to call a 24-hour access number where you're triaged, and then you can take it from there. It's a 5 to 7 day program, and we detox from heroin, OxyContin, the club drugs, of course, alcohol, any kind of opiates. We do have a 5 to 7 day protocol. A strong point at NORCAP is that we do work on aftercare. That's really, really what works in the treatment of addiction. Is you just can't get, sober 5 to 7 days. You need aftercare. You need a treatment plan in place. It's too difficult just to get sober, only being in a detox for 5 days. You need further treatment to make it really work in the long run. So the counselors are very dedicated, and the nursing staff. The minute the patients come in, we start working on their aftercare, whether it's a halfway house or a sober house or outpatient counseling or AA and NA meetings or even a 14-day program. We'll start to get the patients on that road to recovery from our treatment.
So how do you do that? How do you get me motivated to go to AA or to participate in an aftercare? I'm fine now, 5 days.
We have meetings all day long, so you might detox for a day, but the next day you have to go to, we require that you go to meetings all day long, and we have commitment groups every night. And we also have a Friends of NORCAP program, which is thousands of people that have been detoxed through NORCAP. They belong to this commitment group, and they're very active at NORCAP, and they have Sunday morning groups, and they do commitments. And it might be some little thing somebody says in a group that can be inspiring enough to that patient for them to want to seek further treatment. Those commitment groups are so valuable to treatment because it's regular people that have been through it all, that have been through detox, that know what it's all about, that have lost, that have suffered. They tell their stories. It could be something that the patient can relate to and listen to and hear that they might want to seek further treatment. It doesn't happen all the time. But those groups really work. They have individual counseling at NORCAP, and they have group counseling all day and all evening. So that's the treatment at NORCAP. It's not just a detox, but it's the counseling that we offer also.
So you think to some extent that motivates people to commit to some aftercare? That's an outcome measure?
Yes, especially from the commitment groups that come from the outside and come to us and have lived through it. That's when they want to listen. That's who they want to hear it from. They don't want to hear it from half the time from the professionals. They want to hear it from the people that have been through it also.
So how do you deal with let's say I'm a difficult character and I've done well in the 5-day program, and now I say this is interesting, I've learned a great deal, I can take it from here on my own. How do you respond to that kind of scenario?
Well, sometimes people do well in outpatient counseling. We do offer outpatient counseling at NORCAP. We have evening treatment there. We have an HIV group there. They can get help. They can get sober through AA and NA meetings. That's when we make them list all the meetings in their community, where they can go every day and every night. That's part of the treatment plan. So if they're, ready to pick up a drink during the day, they can look in their treatment plan and know, well, it's at St. Mary's Church, at noontime, I'll get to that meeting. So every day of the week, every day and evening of the week, they'll know where they can go for help, for that group support.
Okay, but the fellow who says, I don't need any of that. I'm good now. I'm over it.
Yeah. Well, you know what we say? See you later. See you next week. Because we know they're going to be back. And we do see people come in every week. We do see every week, every other week. That's part of what we have to deal with.
And do you think a lot of those people are on some kind of a learning curve?
It might take them 50 times, 50 detoxes. It might take them 100 detoxes. And I've seen people, I've detoxed people 100 times. It might take them that much, but you know what? That 101 time, that 101 time, they might get it. I've seen it happen. It might take that many detoxes and that many, and hearing that stuff, same stuff over and over again. It might take that long. But that's okay. As long as they get it, they get it.
And then there are, I assume, some sort of what we call treatment failures.
Yeah, it's really, that's a frustrating part in this field, and I always said to myself, hey, if you could just reach 3% of the population, you're doing a good job. That's that's my goal. If I can meet 3% of all the hundreds and thousands of people that I've treated over the years, and people might be doing well one moment, and then boom, the next moment you hear that you see them and they're doing worse. And this is part of the disease of addiction. It's
3%, so that's a very...
That's very low.
Well, it's a very, I was going to say, sober assessment.
Yes. But that's why I don't build myself up, you know what I mean, for my own expectations. If I could just reach that one person a month or a year even, I can be proud of myself.
You've done your job well.
Yeah.
And the other 97%?
It's on them.
What happens, though?
I do my best.
Yeah.
What happens to them, you just have to keep telling them, it's like if they don't get it the first time, who knows? I've seen people that have been just so down and out, so sick, and then turn their lives right around. And I see them like going to the beach, doing normal things, not looking for dope or the drink, doing normal activities. This is what I like to see. You got to teach people how to enjoy life without using substances. There are so many other things to do than drugs. And this is part of treatment, I think, that they're to show them that there's a lot of other things to do. This, whether it's, and that's part of the treatment plan also, to list hobbies, interests, other activities, just other things they can do besides drinking or drugging. That's what they have. That's what they have to explore with counseling, other interests and activities instead of picking up a drink or a drug.
And you think that is a skill that can be taught?
Yes, I do. Yeah, because, at one point in their life, I think, when they were kids, they were doing some of these things. What happened along the way? But, they were bike riding. They did have activities like that. They were in school. They were being educated. I mean, there is... they have, somewhere along the line, they have done some of this stuff. They used to play, I used to be a hockey great in high school. I used to be a baseball star. I used to be this, and well, you can still, you don't have to be a major sports star now, but you know what? You can still play baseball. You can still skate. Maybe those goals that you had when you were younger, you can't get, but you can still do the sport. You can still do it. That's what I always used to tell them. Well, so what? You're not going to be a Red Sox, player, but you're going to be able to play baseball. You know what I mean? That's what I always say. You can still skate, you can still swim, you can still take a course. But you have to get sober first.
Right, but you're saying there are some people who really can't give up that dream of being a Red Sox player. Playing anything less than is just profoundly disappointing to them.
Yeah, and that's what, if they keep holding on to that, they'll keep drinking and drugging also. They'll keep using. if they, that's what, you know, the therapy or counseling or whatever, that's what they have, that's what they need to get rid of that.
So you get back to some core self-esteem issues. I mean, if there's very, very low self-esteem, especially if that's dependent on unrealistic external goals.
And we haven't even touched on, it's like what I've seen in the field is like with heroin addicts, they say 9 out of 10 female heroin addicts are victims of an incest. Doctor, I say 101 out of 100 have been incested. I really do. I mean, there are reasons why people pick up a drink or a drug. I mean, a lot of physical and verbal abuse. That's why it's so important to have therapy, counseling, AA, NA support groups, you know, you know, a higher power, all these beliefs. It's all, they need it all. It's just not one thing or another. They need it all because a lot of times they have really been deeply psychologically damaged. We haven't even talked about that, but it's not a fluke why some people will pick up cocaine as opposed to heroin. You know what I mean? It's like I always believed in the self-medication theory of addiction. And it's not a fluke why some people choose their drugs. It's more than that. It's beyond that. And I think that whether it's one for psychodrama, if it's a psychodrama that they have to relive that incest time period and just have a catharsis and get rid of it and have group support. I've always been interested in exploring other ways of treatment for drug addicts and alcoholics. Whatever it takes, in this day and whatever it takes for them to get healthy again. You know, hepatitis C is rampant. I've seen young people, I've seen people my age by now have cirrhosis, get cirrhosis and die by my age. I've seen it with my friends. I've seen it with my patients. It's not something, it's not a disease to be taken lightly. It's a very...
It's not a pretty picture, as a
It's
friend
not a
would
pretty
say.
picture. It's not a pretty picture.
Well, let's take a break, and then after that, perhaps we'll talk about the road to recovery and what some of the pitfalls are along the way. So, thank you.
They came from every corner of the country. From small towns and big cities. But they all shared one thing in common. They belonged to a family called Marines. A tough and determined few, dedicated to protecting everything we hold sacred. And still they come. Celebrate the 225-year history of those proud few who have earned the title Marine.
You're looking at soldiers, citizen soldiers and their families, members of the Army National Guard. They train part-time to be ready when they're needed by our country. They live in your communities, building civilian experience, pursuing higher education and personal goals. They're friends, neighbors, teachers, accountants, fathers and mothers, sisters and sons, getting good pay and benefits while giving something back to the country they love. Join them. Call 1-800-GO-GUARD and discover the part-time job with full-time pride.
In the Army National Guard, you can.
Well, let's talk about the road to recovery. Why is it so tortuous?
Well, I think just the hardest part is admitting that you have a problem. And once you do that, then everything gets clearer, I think. Then you have to, denial can be so strong in an addict or an alcoholic that that can be a major roadblock to treatment. So you have to cut through the denial and realize that you have a problem. And then from there, then there's so many avenues of treatment that you can explore. But if you're strung out on dope or alcohol, you need to come in to get a medically supervised detox that we have at NORCAP.
Well, that reminds me of a good friend of mine, actually, told me that his second year of sobriety was the most difficult year in his life. Can we talk a little bit about depression and the role it plays? You alluded earlier to self-medication. What are people medicating themselves for?
Loss, life, all the events that can happen in your life, losing people, death, divorce, anything, childhood problems.
So you're muting the feelings you have about those kinds of life events.
Exactly.
Okay.
You're numbing yourself. I mean, heroin is the greatest number that you can have. I mean, you don't feel anything when you're on dope.
So do you teach people at NORCAP, for example, about how painful sobriety is?
Well, we do, but I think that they learn that more with AA and NA meetings because we get them very fresh. We get them really, really fresh. That
Raw.
comes in really raw. That comes in time. What we're there for is to give them a medical detox. You just can't come off heroin and OxyContin and alcohol without help. We use clonidine, Ativan, and Darvon at NORCAP to detox from heroin. We use Ativan to detox from alcohol. We also detox from cocaine and crack and the club drugs, ecstasy, GBH, all those drugs, the rape drug. But they need to be medically detoxed off of those medications, and you can't do it at home.
Right.
So that's why people come into treatment when they
So
realize when they
outpatient
try to
detox.
cut, when they try to stop, they can't because it hurts too much. So that's why they need to come into NORCAP to get that kind of treatment. Outpatient detox, I know people are doing it. I know a doctor that's doing it, but you know what? They need everything when they come into detox. They need the counseling, they need the support, they need their peers. They need all that when they come into a detox.
Are you a loss facility?
No. They come in on their own. They can leave on their own. We also take dual diagnosis patients. We take HIV positive patients. We take diabetics. So we're not afraid of other diseases.
Right.
And we do a complete lab profile when they come in. So we know what their liver enzymes are at. We know if they have hepatitis C or B. We know where they're at.
But just to be a devil's advocate for a moment, it's an invitation to hell, isn't it? I mean, because when you invite me to achieve sobriety, I think there was a mythology during my training that somehow once you achieve sobriety, your problems were solved, when I think the friend I alluded to was basically suggesting that once he achieved sobriety, many of his problems began because all the things that drove him to drink were waiting for him now to deal with, and whatever feelings those stirred up in him, a failed marriage, obviously strained relationships with his children, blah, 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 all as an outcome of the drinking. But really, his sobriety left him feeling profoundly depressed.
That's right, doctor, but you know what? There's medication that for depression.
Do you
now.
support medication?
Yes, I do.
Does
I do.
NORCAP, I mean?
Yes, we do.
Yeah.
We will actually, if they run into problems or severe depression at NORCAP, we can send them to Norwood Hospital where they can have a psych evaluation by the doctor. And we will continue with their psychiatric medications when they're there. We're completely for psych medications. We don't detox, we don't allow people to take benzodiazepines, Klonopin. Valium, Librium, that they've been abusing on the streets. We try to get people off benzos, but the Prozacs, the Depakote, the Neurontin, all those medications, the Zoloft, we want them to take. And we also prescribe, our medical director, Dr. Alpert, prescribes naltrexone for the alcoholics. So we are for that. We don't want people to be depressed, and those drugs do work. So that's fine with us.
Not a lot of Ravia naltrexone being used, but yeah, I agree with you. I think it's a very helpful drug that helps people really avoid the craving of the alcohol and maintain sobriety. But you still do have lingering out there some old sponsors, older sponsors who will say, don't go see the psychiatrist, don't take, you got to do it with a higher power, basically. There's still, a lingering sentiment, which I think leads some people to sort of kind of make life harder for themselves.
Anything it takes for them not to pick up.
Yeah.
You know what I mean? That's the bottom line. Prozac's not going to kill you. Zoloft's not going to kill you. But drinking and drugging will. That's what's going to kill you. So that's old-fashioned. That's not where it's at nowadays, I don't think. It's people, in this day and age, I think most people do need antidepressants. At least most of the population's on antidepressants. But it's not going to kill you, so I don't have a problem with that. We don't have a problem with that at all.
And
You're not going to
families?
withdraw from those medications.
No, that's true. Families, what does recovery require of them?
For them to look at their own issues, for their own lifestyles, for their own issues, and for them to get help too. They need help too, whether it's through Al-Anon or counseling or therapy themselves. They need help too, because they've been hurt also. Addiction hurts everybody. It hurts society, the family, everybody that's involved. It hurts everybody.
A brief vignette, and I'd be curious your response. Woman's yelling and screaming on the phone. I've never met her, that she can't stand her husband's drinking any longer, and she's crying and she's wicked upset. And then at one point she puts her hand over the receiver and yells to her husband, "Where are you going?" And he says, "I'm going out." And she says, "Well, let me give you some money."
Yeah, that's what you call an enabler.
Yeah.
Yeah, there it is right there. What she should do is leave or lock the doors. But that's a typical example of enabling.
So families have a lot to learn if they're going to support their family members' recovery.
Yeah, and they can learn it through going to AA and NA meetings themselves, looking within themselves, reading books about it, and just becoming more educated, being an educated consumer.
There's some very pragmatic questions. Let's say I go from NORCAP to a halfway house. Who pays for the halfway house? Am I charged? How does that go?
Well, insurance.
Insurance will pay, okay. Now, am I able to work from that halfway house?
It depends on the halfway house, really. Like I know the Meridian House in Boston, you can't work. It's like a 9-month program where it's very intensive, and you start from the beginning how to work with yourself from the very beginning. Every program is different.
Okay, so some might and some might not, but most of them.
A lot of the programs, like to the drug court, you might not have a job, but you're going to learn you're going to studying for your GED, or you're going to learn computers, or you're going to learn something about life skills. You're going to acquire life skills.
But let's say I have a trade. Let's say I'm a teacher, or I'm in the professions, or I'm a psycho, whatever. I mean, if I commit to a recovery program, am I going to lose my ability to practice? I mean, I'd like to go back to work as soon as I could.
You can't, if you're drinking and drugging, you can't do that anyway.
Right.
So you might as well take
I've been doing it for years, you might hear. I haven't, but I mean, somehow, yeah.
But I had a professor in college that was, 2 professors actually, that were active alcoholics when I had them, and it was damaging. It was very damaging to me as a student and to other students. One was very verbally abusive and actually became physically abusive to me. Now that she's sober, wants to reach out and apologize to me, which I haven't had the chance to talk to her. I never wanted to. But it can be very, very damaging, and you think you're getting away with it, but you're not, and you're very ineffective, and it's damaging to people.
So you're suggesting that it might be not advisable for me to go back to work until I'm really on top of...
No, you need the time for yourself. You need the time for yourself to get sober and take care of yourself. And you can't take care of anybody else unless you take care of yourself first.
So really you've defined that there are generous service systems out there, NORCAP being one of the exemplary models. Insurance covers for a lot of what people need. People worry about that.
Insurance is a rough subject nowadays, but for the most, they have cut down. I don't really want to get into the insurance issue right now because I don't want to mention any names, but one insurance company right now doesn't even want to pay for inpatient detox. They don't think heroin addicts need an inpatient detox anymore. So it might down the road get a lot rougher in the field with insurance. It's a real touchy subject, as you know, working in the medical field today. But for the most part, there are a lot of public detoxes also that people can go to that don't cost anything. So there are places, even if you have no job, no money, no insurance, there are places for people to go.
So in this whole Norfolk Valley, where do I start in a sentence or two?
What you can do is, we have a 24-hour access telephone number that you can call for NORCAP. If you want to stop drinking and drugging, if you want to put the crack pipe down at 3 o'clock in the morning, there's a 24-hour public access number that you can call where you can get triaged and come to NORCAP. So all you have to do is drop that dime to get treatment.
It's that
simple.
Then you get a roadmap of where you might go and what the possibilities are.
Yeah. All you have to do is know that you have a problem and make that call. It's as easy as that.
Excellent. Well, listen, I want to thank you on behalf of the Norfolk Alliance. It really has been I think, a very useful discussion about, obviously, a very important problem area. So, thank you.
Thank you.
Very much enjoyed talking with you.
Thank you.